So we've spoken a lot about inflammatory conditions in the bodies, all these fistulas, osteomyelitis, and we also spoke about when there's collection of pus in the body. Okay, that's collection of pus within a body compartment. After a long time, there's a formation of a passageway so that pus can be can be drained to the skin surface. Okay, so we'll call that the sinus tract formation. So one of the ways of trying to repair all those inflammatory conditions in the body is you have to cut out that sinus tract. So they call it the sinus tract excision surgery. Can you see this? This is a sinus tract. So they cut it out. So when you cut it out, you drain the pus that is left. Then you wash, and that condition might basically be solved. So it's just a surgical procedure. It's performed to remove a chronic sinus tract. Okay, so which is an abnormal channel that connects a deep-seated infection, which is draining its pus on the outside skin. So that's it. The tract often develops after infections, abscesses, or osteomyelitis. Basically, it's collection of pus. So the pus needs to be out. So it's the body's natural way of trying to drain. So sinus tract is different from fistula. So sinus tract connects a deep infection to the skin surface, while fistula is what? Connection between two epithelial surfaces. So get the difference. Okay. So common sites, maybe you have a bone. Okay, chronic osteomyelitis, perianal region, and also the pilonidal. See, the pilonidal sinus tract excision surgeries. So indications for this excision is if there's a persistent or recurrent drainage despite conservative treatment, if there's a chronic infections, this pilonidal sinus disease, if you have a sinus that has not been healing even after many surgeries. So first you have to localize it, you have to excise it, then you also debride. You cut out any dead tissues around that area, then you suture and close. So clinical significance is complete excision is important because partial removal may also lead to the sinus tract coming up again. Okay, so this is what we got for we are talking about sinus tract excisions.